Hello all. This is a recording of the introduction given by Dr. Ramesh Babu for Dr. L. Prakash oration. Here is the brief bio. His educational qualifications are MBBS, MS Ortho, MCH Ortho, and it's from Liverpool, and AO Fellowship, Basel, Bern, and Davos. Arthroplasty Fellowship from London, Oxford, Ringtington, and Bern. He is the mentor and founder president of IAOS, that is, Indian Academy of Orthopedic Surgeons, past vice president of IOA and past secretary as well. His renowned surgical skills, especially in revision arthroplasty and surgery. He have written many books, including Biological Methods of Fracture Management and TPTS method, that is Tangri Prakash Trauma System. He is an acclaimed teacher with 40 plus years of experience. He have decades of orthopedic teaching. He is the inventor of PFO in a medial compartment OA knee. PFO stands for proximal fibular osteotomy. And also he invented reduction technique of a dislocated shoulder without anesthesia, sedation, no assistance, no traction. He is the inventor and designer of hip and knee prosthesis. Factory section for knee prosthesis designed by Dr. L. Prakash. He took this photographs from the factory, as you can see. Yeah, and also he's inventor and designer ultralight Ilizero rings, as you can see it in the image. And also he's a polymath. A polymath is a person who expertise spans a significant number of different subject areas. Such a person is known to draw on complex bodies of knowledge to solve specific problems. And he's a scientist, prolific teacher, and a brilliant surgeon. Yeah, a brilliant and well articulated author too. 1,000 articles, publications, 20 orthopedic textbooks. These are the few books you can see. Atlas of Primary Hip Arthroplasty. Yeah, a beginner's guide to total knee replacement. Atlas of Hip Arthroplasty. The book volumes you can see. Atlas of Orthopedic Surgical Exposures, The Magic of Ilizero. You can see all these. Biological Methods of Fracture Management, Pain Portal Blocks, Ozone in Musculoskeletal Disorder. More than that, 150 plus novels, non-author books, you can see. Recognition by the IOA in 2021. He got an award. He got a book award. Yeah. He portrays his own methods in his books as well, which is very different. He's an artist and medical illustrator. He knows, like, he's beyond everything. You can see he's a sculpture. He have made selfie sculpture. He is inspirational to many surgeons worldwide. He have many non-orthopedic skills as well. You can see he's a magician. You can see everything in the photos. Yeah, thank you. Now Dr. L Prakash will teach you or present you with this topic, new vistas in musculoskeletal disease management. Thank you.
Good morning, friends. It's a great pleasure to present before you Dr. Swami Subbarayan oration, the sixth oration of 2024. Dr. Subbarayan lived a productive life between 1926 and 2019. He was an alumni of Government Stanley Hospital, a father of 3 doctors and grandfather of many other doctors, was the first family physician to start X-rays in private practice in Tiruvannamalai, eminent scholar, philanthropist, a winner of numerous awards, who left his footprints on the sands of time. The talk in his honor is New Vistas in Musculoskeletal Diseases. In this talk, I will discuss 2 subjects relatively new: physiological pain portals and molecular therapeutics. I am Dr. Prakash, originally from this city of Chennai, now in Palakkad. The first topic I am going to discourse upon is physiological pain portals and the sodium channel blocks. What are pain portals? The exact spots where the cocktail has to be injected. The upper limb portals are called the alpha portals. Lower limb portals are called the beta portals. Trunk portals are called the tau or T portals, and head and neck portals are called the kappa or caput portals. The composition of the cocktail is as below. As listed below, the crux of the solution that produces seemingly miraculous results is pentadiluted, diluted 5 times xylocaine, which is 0.3 to 0.4% concentration. The cocktail will include 1.5 milliliters of 2% xylocaine, 30 micrograms of clonidine, 10 milligrams of depomedrol, and 7 milligrams of water for injection. In case of fractures and acute trauma, the cocktail essentially remains unaltered except for the elimination of steroids from the mixture. Pain portal injections have become very popular nationally and internationally. The book has run through many editions and has been translated into many languages, including Italian, Spanish, and even Japanese. The latest edition is a bestseller which has sold over 3,000 copies and still selling very strong, making it one of the best-selling orthopedic and pain management books in the country. To show you how and what a pain portal block does, I am displaying an example video. This video is from a patient in South America, spondylolisthesis grade 4, L5 and S1 disc, with the patient unable to stand and walk unassisted, with a very grossly diminished straight leg raise test. Here is the patient immediately after the injection, raising her thumbs, her eyebrows arched in surprise, now getting down unaided and unassisted, walking around the doctor's clinic, gradually picking up speed, smiling, and eventually doing a little dance gesture to show her happiness. Now these are two different patients, one from Peshawar in Pakistan, one from Maharashtra in India. We can listen to their stories in their own voice.
Zamir se blazu chetka. نور نو چتیږي بس لاندې دغه روغ لازو چتکا زبردست ډېر لږه دغه تکلیف زته کم ذکر دی صحیح ده سویم ورځ ده صحیح شو صحیح ده اوکې ده اوکې 3000 بسم الله کلاس چتکا زبردست ډېر ښه یو چتکا زبردست ډبل چتکا آخا ډېر ښه کوم ځای کې ماسته راوخلې اردو ویلې شي اچھا کیا تکلیف تھا آپ کو
मेरे पास कोई कह रहा था फटा हो गया क्या कह रहा था मालिश वगैरह कराची इधर आपने इंजेक्शन लगाया
अच्छा अभी बोलो कि थैंक यू डॉक्टर प्रकाश डॉक्टर प्रकाश थैंक यू ओके
अंकित सुराना आपको ये तकलीफ जो है क्या है और कब से है? थोड़ा सर्वाइकल है और थोड़ा शोल्डर में प्रॉब्लम है। कब से है? 1 महीने से। ठीक है, हाथ ऊपर करिए। दर्द जब तो बताइएगा। यहाँ पे ठीक है, नीचे करिए। यहाँ पे मतलब वो नस भी खींचती होगी। ठीक है, सामने हाथ करिए। अभी कहाँ दर्द होता है? यहाँ पे। ठीक है, नीचे करिए। अभी आपको जो इंजेक्शन दिया है, अब आप अपना हाथ उठाइए, जैसे पहले साइड में उठाइए, साइड में लेके जाइए, धीरे-धीरे जाइए, जितना ज़्यादा आराम से ले जाइए ऊपर, ठीक है, नीचे कर लेते हैं, धीरे-धीरे आ जाइए, धीरे-धीरे आ जाइए, ठीक है, अब सामने कर रहे हैं, जितना ज़्यादा है उसे आराम से लेके जाइए, जबरदस्ती मत करिए, ले जाइए, नीचे कर लीजिए।
Both of these patients were advised surgery, arthroscopy, rotator cuff repairs and the like. The next patient is my own butcher who supplies mutton for my dogs. He had come to me on a Sunday morning to my house to borrow 5,000 rupees for getting an MRI scan done. He was not able to walk. He was supported by my assistants. As I keep all the block materials at home, I injected various spots, beta 1, 2, 3, 4, 5, and there he is immediately 10 minutes after the block, walking unaided, unassisted, with a smile, and sitting on a chair. That's him in the evening, who came to me to deliver the mutton, completely relieved. He neither needed an MRI nor needed any surgical management thereafter. Herpes zoster fulminant, just with tau blocks. On day 3, no antivirals given. We can see that the lesion has completely healed. Initially described for disc and neurological issues, these portal blocks are turning out to be increasingly useful in trauma and may soon become game changers in many situations. Interesting case from South America. Young lady, horse rider, in competitive horse riding, fell down from the horse, fractured the lateral most end of the clavicle, just near the acromioclavicular joint, had to participate in the race the next day, was advised hook plating by many other surgeons. However, she went to the practitioner who was familiar with the IAOS methods and got an alpha 1 block done, and this is the lady immediately after the injection with a fracture. Remember, she had sustained a fracture less than 3 hours ago, and she is very desperate to participate in the horse race the next day. The right side is fractured, but she is still determined to move it in all directions just by a single block. This young lady was bold and brave, not only to get back to her function, but participate in the race on the next day and get a silver medal. And she sent me a personal message of thanks via her doctor. Let us next come to intertrochanteric fractures. We all know the tragic story of operated intertrochanteric fractures in the elderly. 50% never recover fully, 20% die within a year, 30% have got permanent disability, 40% are unable to walk independently after the surgery. It is actually now studies have shown that less than 50% or 60% of patients live to see their next birthday after sustaining this fracture. Man is born through the pelvis and dies because of hip. However, at IAOS we have defined and refined an entirely different method of management of not some more than some of these fractures based on sound orthopedic principles. However, the concept may look a little unusual. Please listen to this with an open mind. This is a case of intertrochanteric fracture, and you can see the situation. This is the patient who was my relative, intertrochanteric fracture, blocked, started walking immediately after the fracture. He was scheduled for a surgery but preferred this form of management. My nurse went to his house and kept injecting, and there he is at the end of 45 days with his fracture united. This was one of our earliest cases which gave us courage to proceed and start managing these fractures non-operatively. You can see an example on day 1, day 30 and day 80. Another example on day 1 and day 91. This is a spot beta 6 which is in the inguinal crease a little away from the femoral neurovascular bundle, and injecting this spot makes the hip absolutely pain free. You can make the patient stand up and walk and put full load and full weight on the hip and walk. Another case you can see day 11 and day 100. This is an unstable trochanteric fracture. Patient gave a written consent for shortening, and the same was managed by blocking and walking. Radiological and clinical results in 3 months are here. It is yet another case treated non-operatively. These days, people do not trust videos or talks. They want publications. So we collected the cases and made a paper which has been published in the prestigious Hip International in 2022. This was our preliminary study of 23 patients. Subsequently, we have now a study of 340 patients, and this will be published soon in a prestigious journal. I shall run through quickly various portals followed by specific indications. Alpha 1 is the first web space portal, an exemplary portal, can be given superficially, subcutaneously, or into the fleshy part, the same results, and is a sure shot portal which gives immediate reproducible results in a large variety of cases like periarthritis of shoulder, supraspinatus tendinitis, rotator cuff tear, shoulder dislocations, fractures of the clavicle, fracture of the neck of the humerus. In addition, it is also useful in elbow dislocation, supracondylar fractures, fracture head and neck of radius, intercondylar fractures of distal humerus, cervical brachialgia, tennis elbow, golfer's elbow, pseudax atrophy, and acromioclavicular joints and lateral clavicular fracture complex. The alpha 1 subportals are usually used in combination with alpha 1. They are alpha 1A, B, C. Their indications are Colles fracture, Smith fracture, all articular and periarticular wrist fractures, complex regional pain syndrome and pseudax atrophy, carpal and metacarpal fractures in association with hematoma blocks and local anesthetics for K-wire pinning, TPTS, mirrors, essential tremors. These are alpha 1A, alpha 1B and alpha 1C portals. In addition, we have now introduced a few new portals which are being announced for the first time here. Alpha 2A between the 4th and 5th metacarpals dorsally. Alpha 2B, the mid-palmar portal, and alpha 2C, the hypothenar eminence portal, alpha 2C. Alpha 2 is a very useful portal. The injection is administered just underneath the deep fascia in the carpal tunnel. So that is alpha 2. It is rather superficial portal. You don't have to go inside or touch the tendons or do anything like that. And this is an adjuvant portal for numerous conditions requiring alpha 1 injections. Furthermore, this is the most effective and important portal for chronic regional pain syndrome, pseudax atrophy, shoulder hand syndrome and similar disorders. This has to be repeated every 7 days along with medical management. We do not use steroids for this portal because the injections are repeated frequently. Alpha 3 portal is 2 centimeters above medial epicondyle of humerus and the portal is along the course of the ulnar nerve before it enters the cubital tunnel. The injection is given deeper to the deep fascia, avoiding injection into the nerve. This is the correct position of alpha 3 portal. Alpha 4 portal is 2 centimeters above the lateral epicondyle of the humerus along the course of the radial nerve before it winds around the lateral epicondyle. Alpha 3 and alpha 4 portals are principal portals for tennis and golfer's elbow and also adjuvant portals for cervical spine. These are the adjuvant portals, very useful in cervical spine issues. Alpha 5 is given at the insertion of deltoid muscle, can be given either subcutaneous or submuscular. We do not need to go deeper because of the neural structures below. And the alpha pi portal or deltoid portal is an adjuvant portal, mostly for conditions requiring alpha 1 portal, and in combination with alpha 6 portals is excellent for managing humerus fractures and giving extension cast, neck of humerus, surgical neck of humerus. Alpha 6 portal is at the inferior attachment of scalenus anterior. This is a subcutaneous portal. We must not go deep. Just entering the skin and giving the injection is enough. Alpha 7 portal is the tip of the acromion process where it meets the clavicle. Now a combination of alpha 5, 6 and 7 portals, I will show you the results in an acute trauma, a 3-part fracture neck of humerus. This patient was advised a Philos plate by no less than 6 orthopedic surgeons because he was young and active. But our IAOS colleague, who believed in our methods, treated him by just these blocks and full function from day 1. And you can see that on 21 days the fracture has fallen into place and the patient is able to move his hand immediately after the block. The patient actually drove a bike back home, and the greater tuberosity and the fracture have all come into place, clearly indicating that Philos is a grossly overused and often needless implant. Alpha 7 is the spot where it has been shown previously, where the acromion and clavicle meet, and that is a fantastic portal for tremors. You can see the patient on the right has Parkinson's tremors. This elderly gentleman was not able to sign his pension check. Nevertheless, the son brought him to a colleague who is an expert in IOS methods, and he was given alpha 5, alpha 6, alpha 7 blocks as
Within 5 minutes, the intentional tremor gone.
And in 5 minutes, the tremor disappeared. And the patient is able to sign his check and get his pension. These are the new portals. Alpha 8, which is the anterior axillary fold, and alpha 9, which is the posterior axillary fold. You can see in this patient and hear from her own voice what she says.
ये जो हाथ कांप रहा है कितने साल से कांप रहा है ऐसा होके? ये जो हाथ कांप रहा है कितने साल से कांप रहा है? 3 साल से। 3 साल से। ऐसे ही होता है। 3 साल हो गए। ऐसे ही होता है। चोट लगी थी 3 साल हो गए। चोट लगी थी। ये अपने आप ही करने लगे ऐसे? अच्छा। ये अपने आप ही करने लगे ऐसे?
Immediately after the injection, she has got a steady hand. Another case, intentional tremors, specifically on holding objects. She gets tremors when the object is
Get
taken
up,
away.
get up.
It becomes still. You can see the immediate effect of the hand is stable. On the other hand, also the object is given, her tremors have disappeared. So this was a discourse on upper limb portals, alpha portals. Beta portals are lower limb portals. Beta 1 portal is situated anterior and inferior to the lateral malleolus at the spot where the talus, calcaneum and cuboid approximate each other. For backaches, sciatica, MRI proven slip disc and conditions where endoscopic or open surgeries are advised, beta portals are very useful in combination. I must clearly tell here that beta portals used in isolation are not as effective as beta portals used in combination. Here, the three portals are adjuvant, complementary and work together well. Beta 2 portal is behind the lateral malleolus. Beta 2 is behind the lateral malleolus. Beta 3 is behind the medial malleolus. Next adjoint portal is beta 2A, which is between the shafts of 4th and 5th metatarsals. This is a wonderful and lovely portal for osteoporotic wedge compression fractures with severe back pain. The results of this portal are simply outstanding. Other adjoint portals are beta 1A, beta 1B, beta 1C and beta 1D. With audio, you can see the patient's movements. This is the pre-injection treatment.
दर्द हो रहा है? दर्द हो रहा है? बहुत ज़्यादा दर्द है। ठीक है, इसके ऊपर नहीं जा रहा है ना? ठीक है, ले लीजिए धीरे धीरे नीचे। हाँ, लो नीचे। हाँ, एक बार और उठाओ। उठाओ एक बार और। है जादू। चलो ठीक है।
Another patient, we can see and hear her own story in her own voice.
दिक्कत बताओ और क्या दिक्कत होती है? उठाओ जितना आराम से उठ रहा है। बस इतना ही उठ पाता है। जहाँ दर्द हो रुक जाना। नीचे करो। नीचे कर लो पैर। दूसरा पैर उठाओ। ये ठीक है। ठीक है। और चलने में कितनी दिक्कत होती है?
चलने में तो ऐसा ही दवाई खाने में तो सही चल पड़ूंगी।
हाँ। कितने दिन से कर रहे हो तुम्हें? चलो ठीक है। उठाओ पूरा उठाओ। अब नीचे करो। फिर उठाओ, फिर उठाओ, और उठाओ, और उठाओ, उठाओ, उठाओ। हाँ, अब नीचे करो, अब नीचे करो। अच्छा, दोनों पैर उठाओ, दोनों पैर उठाओ, पैर उठाओ, पैर। हाँ, हाँ। अब नीचे उठ करो, अब नीचे उठ करो। ये फिर उठाओ, ये फिर उठाओ। दूसरे वाला भी उठाओ, दूसरे वाला इंजेक्शन लगाओ। हाँ, उठाओ, हाँ, उठाओ। नीचे करो, नीचे करो। फिर उठाओ, फिर उठाओ। फिर नीचे करो, फिर नीचे करो। आराम मिला है, आराम मिला है। चलो ठीक है।
This patient says that she has got a 90% relief with a single injection, and this young lady was advised endoscopic surgery by more than one spine surgeon. Beta 4 portal is in the interosseous space between tibia and fibula, about 2 to 3 centimeters below the fibular head. Beta 5 portal is in the belly of calf muscle and is principally diagnostic and therapeutic portal for osteoarthritis of the knee. Recently introduced beta 5b portal in the popliteal crease, also called as a Sahotra portal, is a very good portal for osteoarthrosis of the knee and shall be described in detail in a future edition of the book. Beta 4 and 5 portals are adjuvant portals for back issues and are extremely useful in osteoarthritis, rheumatoid arthritis, for immediate pain relief, can be used as a diagnostic criteria for deciding whether the patient needs a PFO, and the duration of relief depends on additional management like Mukherjee regime or PFO or rebalancing or splints or needle plasty. Here is a patient. I am going to run the 3 videos one after the other, which will show how his gait changes immediately and after a week after block.
वापिस आ जाओ, वापिस आ जाओ,
So,
आ जाओ, आ जाओ।
extreme distress on the left.
हाँ हाँ हाँ, अब ठीक लग रहा है पहले से? चलो
You can see the patient.
चलो।
How well and good he is improved. Beta 5a or shin portal, recently introduced by Dr. Divakar, is a wonderful portal and is useful in numerous conditions, mostly as an adjuvant for beta 1, 2, 3 and 4 portals. Beta 6 portal is the inguinal crease portal. I have already shown you the miracles of metatrochanteric fracture before, and this one is an example of an undisplaced trochanteric fracture. The surgeon dons the glove, part is draped, spot is located, beta 6 block is given, and immediately she starts moving the limb. There she is, getting up and walking out. She stayed in the hospital 3 days. Block was repeated on the 3rd day. Went home on the 5th day. Weekly blocks were given by the staff nurse. Without surgery, the fracture united in as little as 62 days. One more fracture uniting with block and walk. Beta 7 is a mid-iliac crest portal, useful adjuvant for beta 6 and tau 4 portal. Trunk portals will be described subsequently, and you will learn what is tau portal. Beta 8 is a mid-thigh portal, which is trans-quadriceps deep portal until you hit the femur, a long needle is required. This is an excellent portal for phantom limbs. Beta 9, first announced by Dr. Dayanidhi, is a patellar portal. Hit the patella and drop. Additional portal with beta 1, 2, 3 for sciatica and good pain relief for ankle fractures treated in plaster. Tau portals or trunk portals are 8 in number, have a very wide range of applications, and these are classified and designated as under T1 is mid-sternal portal, T2 is mid-axillary portal, T3 A and B are supra and infraumbilical portals, T4 is sacroiliac portal, T5 is transverse process portal, T6 is inferior scapular portal, T7 is superior scapular portal, and T8 is just below the anterior superior iliac spine. So these are the 8 tau or trunk portals with a lot of indications. These can be called as revolutionary portals because they are useful in large variety of cases like COVID pneumonia, chronic obstructive pulmonary disease, abdominal colics, corona diarrhea, compression fracture of the spine, rib fractures, herpes zoster, assisted physiotherapy in chest infection, back pain without radiation, spondylolisthesis, and failed back syndrome. Tau 1 or mid-sternal block is extremely useful in a large number of chest-related issues. Tau 2 is a mid-axillary block. Any rib can be hit in the mid-axillary line and is indicated in fracture ribs, single or multiple. Interesting aspect which I have learned over the years, that the spot of injection is not related to the rib fracture site. The fracture of the rib may be proximal rib or a distal rib, but injecting the middle rib itself produces dramatic relief. Theoretically, it is advisable to inject the middle of the fracture rib series, but any rib injected in the mid-axillary line produces a dramatic relief of pain of fractured ribs, eases the labored breathing considerably. Tau 2 block in combination with Tau 1 and 3-4 is also a revolutionary block for herpes zoster and herpetic neuralgia. The pain relief is instant and dramatic, and in combination with antivirals, this block converts a painful debilitating condition into a much easier one. Here is a case of herpes zoster, and we can see day 1, day 2 and day 3. Tau 3A and 3B portals are supra and infraumbilical portals administered in the muscle belly of abdominal muscle 1 centimeter above or below the umbilicus, and they have got a huge role in numerous conditions. Terminal palliative management for malignancies, multiple secondaries, opiate dependent patients in whom blocks reduce or eliminate the need of narcotic analgesics. Many orthopedic surgeons, mothers who are dying of multiple secondaries due to uterine cancer have led peaceful non-narcotic based terminal life because of repeated blocks. Tau 4 is a sacroiliac block given left and right. Tau 5 is a transverse process portal administered in the paraspinal muscle above or below the transverse process. These two blocks have wide range of indications: compression fracture of vertebrae, fractures of transverse process, non-specific backaches, low sciatica in combination with other blocks, renal colic due to renal stones, fatigue backaches due to prolonged sitting and working. Tau 6A and B are supra-infrascapular portals, and Tau 7 is a posterior superior iliac portal on either side, which is a very effective adjuvant portal to beta 6 and beta 7 for proximal femoral and acetabular fractures. Tau 8 is a PSIS portal, is an ASIS portal and given over the other side, other very effective portal to beta 6 and beta 7 in femoral and acetabular fractures. Next is kappa or head and neck portals. These are the portals around the skull and find a great use in migraines, headaches, wry neck, etc. There are 3 portals. There are actually 7 portals: kappa 1, 2, 3, 4, 5, 6 and 7. Sorry for the mistyping. Kappa 1 is a mid forehead portal. The frontal portal or the bindi portal, injection is administered in the middle of the forehead, in the spot where the woman usually apply bindi. This is the kappa 1 portal. The kappa 2 portal is a temporal portal. The injection is administered on either side into the temporal area 1 centimeter above the earlobes. Kappa 3 is an occipital portal. The injection is administered to the base of the occiput at its lowest part, being posterior and central. Kappa 4 is a mastoid portal lateral to the middle of the nose. Kappa 5 is a temporomandibular portal going over the TM joint. Kappa 6 is a mandible angle just about a few inches below the ear, and K6 is a mid-mandibular portal. Most of these portals are used in combination with one another. This is a pain portal for headaches, useful in tension headache, in combination with kappa 1 portal, wry neck, stiff neck, torticollis, painful cervical spondylosis, cervical brachialgia, facial twitches, Bell's palsy. This video shows you my own situation. I had very bad facial twitches starting at 6 a.m. in the morning, continuing till close to 11 p.m. and these twitches did not stop. You can see the twitching in the video just above my moustache. I panicked and consulted my neurosurgeon friend, who said that such twitches are probably indicative of some pituitary anomaly, and advised me a MRI and CT scan the next day. I anyway decided to try blocks on myself using an insulin syringe I gave kappa 1, 2, 3, 4 and 5 blocks on myself, and within 5 minutes I was normal. In an hour after a bath, my twitches stopped, and after a small drink of vodka, I was back to normal. Thereafter, I never took a CT, and it's 3 years now, and I am completely relieved and happy and pleased. So, the take home messages from this talk: the block has drugs of less toxicity than a single diclofenac injection or a paracetamol infusion. So do not hesitate to repeat them often. Block all fracture patients when they enter the hospital. Learn the block so that you learn to take pain-free X-ray. An X-ray must not be a torture to the patient. Please remember, use cocktail and steroid only for the first time. Thereafter, use only Xylocaine with clonidine. While I was making this slide, this was the message from one of the friends, Dr. Mohsin. After DSCB Alpha 1, after 1 day, smile gives satisfaction. Thanks, Dr. Prakash. That is the patient post chikungunya, extremely stiff shoulders. The patient is not able to move the shoulders. 6 weeks of agony. And the patient is able to move and she is extremely happy and blessing the doctor and blessing the community. Next is this gentleman who had an L5S1 lesion, cauda urinary dribbling and a foot drop. Advised endoscopic surgery by many surgeons. You can
कब से तकलीफ है?
see what
कब से तकलीफ है? अच्छा ये
चला के दिखाइए जरा, ये नहीं हिलता है, ये पैर हिलाइए, जैसे ये चलता है ऐसे चलाइए, इसके ये चलता है नहीं चलता है, ठीक है। आज हम आपको एक इंजेक्शन देंगे, उससे कितना इसमें आराम मिलता है या कितना पैर में ताकत आती है, कितना पैर में ताकत आती है, ठीक है। आपको हमने पहला इंजेक्शन दिया था, तभी पैर को दिया था, अभी एक इंजेक्शन के बाद अभी हम पैर को देखेंगे कितना चला पा रहे हैं। चलाइए जरा, कितना चला पा रहे हैं, चलाइए अच्छे से, चलाइए अच्छे से, पूरा खींचने की कोशिश करें। हाँ वेरी गुड, कोशिश करें, हाँ वेरी गुड, ठीक है, बस ठीक है, हो गए, ठीक है, बस ठीक है, हो गए।
The smile on the patient's face tells you how dramatic the relief is. Remember the portals and inject into correct spot for consistent and good results. I hope you enjoyed this talk, and now we will move on to the next topic of molecular therapeutics, which I think is best kept as another talk and another recording so that we do not bore you. Thank you very much, friends, for listening to the talk. Thank you. This example will show you how blocks and early function speed up the bone healing dramatically. This was a lady from Italy who had gone to Amritsar on a religious visit, fell down in the bathroom and had a trochanteric fracture. Her Italian doctor, who was a participant in our course group, asked a question in a group from Italy whether anybody could make her walk with a block in Amritsar. The patient was referred to one of our other colleagues, Dr. Deepak Sahota, and there she is after the block.
evening, Dr. Prakash. Such a blessing to know you through my dear doctor, Dr. Julia Silvestri, that asked you for guidance, and you sent me here to Dr. Deepak. And I'm so blessed, so happy. Look at me, I'm standing, I'm already walking. It's all Vaheguru, it's all the miracle of God. Thank you for all your knowledge. Thank you, Dr. Deepak, for this, taking such a good care of me. Vaheguru, thank you.
And this was the lady walking or nearly carrying a walker in 15 to 20 days. You can see the speed of her healing. There she goes at the end of a month in one stick, and in about 5 weeks she is like extremely active and happy and has gone back to her social functions. You can see the dates on the X-ray. It's 3rd February 2024 that she breaks the trochanter, and 24th March you can see an X-ray with a solid union. That is her, and walking without any support for 6 to 8 weeks, and there she is. And there she is, finally back to her full action in 2.5 months. That is the magic and miracle of blocks and walks, which is a new vista in orthopedic and musculoskeletal pain management and management of fractures and bone disorders. Thank you.
Good. Yeah, I think I will breathe more. Let's make it back. Thank you.
I think we can break for lunch, and immediately after lunch we have a few patients and we will have a live demo of whatever we have done now, and feel free to ask me any doubts. Thank you very much. He has come from Egypt.
No, I come from UAE.
Yeah, he has come from UAE. Egypt and UAE, all. If you are interested in learning about these blocks, the Indian Academy of Orthopedic Surgeons has a 4 months online fellowship course with certification. The course comes in the form of online lectures, lessons and videos, and a print hardbound book is sent to you by courier. At the end of completion of the course, you will get a certification for the same. If interested, you can send a WhatsApp message to the number mentioned above. Thank you very much. Thank you.